Welcome to lesson number 7, Cannabis for Prevention. This is the final lesson of module number 2 of the Sacred Plants Healing Brain Masterclass, and I'm your host, John Malanka. In our last lesson, we learned about the 5 pillars of brain health. As we continue this conversation, we now want to understand what role can cannabis play in supporting the 5 pillars of brain health. Since starting my path over 8 years ago, I've been an advocate for cannabis as a prevention and overall wellness. We've learned from other sacred plant experts that can be helpful as it relates to cancers and bone conditions and many other conditions as well as ailments. Dr. Stein will now further help us understand just how powerful medical cannabis can be for our brain-related diseases and disorders as well. Together, we'll go over some of the newest research and case studies that are changing perspectives of doctors and patients around the globe. I'll let Dr. Stein take it from here. So welcome back, Dr. Stein, and welcome back to our Sacred Plant family. This is our last lesson in Module 2 before we get into the heavy nitty-gritty of cannabis and different ailments, brain disorders, and the different types of cannabinoids and what they're used for, and phytocannabinoids, what they're used for. But in regards to prevention, can you share any case studies, some personal studies about medical cannabis, and some new studies that are out there on medical cannabis?
I think this is a very important topic because we want to prevent disease. I can tell you that in neurology, once neurological problems happen, it's usually not good. Of course, we can do really well with things like migraine and back pain, for example, but conditions that are more chronic and debilitating are often difficult to treat. That's one of the reasons I became interested in cannabis therapy as a useful alternative. Preventing disease, that's really the standard that we want to try to achieve as much as possible. You know, I believe in China, physicians are paid for preventing disease. And if their patients end up in the hospital, they lose money. So really, you know, we should remain focused on primary care, prevention. And I think there's a place for cannabis. There was a study in Jamaican families who use cannabis as a regular lifestyle, including during pregnancy for some of the moms there. And this was a long-term study that was done by, I believe, Melanie Dreyer. Okay. And over 15 or 20 years, she made several visits to Jamaica and studied the outcome of cannabis as a lifestyle for pregnant moms, and then how their kids turned out. And it turns out that they did very well. Although we don't recommend cannabis use in pregnancy or during breastfeeding because we don't know enough about it, it seems as though the risk is very low. And in fact, some of these kids turned out to have higher cognitive scores compared to other children at the same stage. Mm-hmm. So there may be a role for cannabis as a lifestyle in not only preventing disease, but promoting better health. I can tell you also that I see a number of patients come into the office who have been using cannabis their entire life, and they move to Florida, or they want to get their cannabis card so they can be legitimate with their therapy. And many of them are extremely healthy, active individuals, socially involved, productive in the workplace. And I look at them and I think to myself, this is not the stoner stereotype that most people think of. This is a high-functioning individual that has incorporated cannabis into a healthy lifestyle. So I think we have a lot to learn still about how exactly to use cannabis to promote primary prevention, avoid disease, and maybe even reach higher heights with what we have to work with.
And so are you okay by recommending cannabis to a patient that is living a high-intense lifestyle, healthy lifestyle, athletes, is it more for sleep and rejuvenating the body? Are you okay with that? Because a lot of doctors throughout the United States that I've spoken to, they've turned down patients saying, clearly they're not falling and they're only here just to get their card.
Well, when it comes to recommending cannabis in Florida, we have to have what's called a qualifying condition.
Okay.
We're not allowed to suggest cannabis use in those individuals who don't qualify. But let's say, for example, someone who's an avid bicyclist, and they train hard and they have chronic pain, and they need cannabis to help them with their chronic pain syndrome. I have no problem suggesting that cannabis will be useful for their chronic pain syndrome and may actually enhance their training schedule. We have information, and Dr. Greg Gerdeman is a big proponent of this, that cannabis can help before training sessions and also help with muscle recovery after. So I would refer our listeners who are interested in learning more about that to look for Dr. Greg Gerdeman's work on that.
Yeah, and we've had Dr. Gerdeman in our past docu-series, so if you want to go back and check those out, it's full of a lot of information. It's unfortunate because a lot of athletes, top athletes, in the NFL, NBA, NBA, NHL, they're not allowed to do this. Even in the Tour de France, I'm a big cyclist, and that's one heck of a race, and they're not, and I believe they're not even allowed to have ibuprofen as the banned substance. So what do you say for athletes? It helps with recovery. You think it's an enhancement?
I don't. Mm-hmm. I think it's ridiculous that professional or for that matter amateur athletes are limited in their freedom to use cannabis. It may enhance some of the muscular function in some individuals, but I don't believe that it's on the same level as juicing with steroids or doping with hemoglobin extracts, or for that matter taking stimulants like amphetamine-based chemicals. Cannabis seems like a much more reasonable and acceptable way to reduce the risk of injury, reduce the pain during recovery. And sure, it may enhance motivation and performance. It may help athletes get into the zone, I've heard. And many professional athletes use cannabis. I don't see that as being a problem, frankly.
And does this topic come up, with your patients that come in? Say even a patient that comes in and brings one of their loved ones in, and just after talking and hearing what you're doing for the other family member, they said,
yeah, maybe it'll be good for me.
Maybe it'll be good for me.
Yeah, that comes up.
And I flash back in 2011 when Corinne was her father's caregiver, and we went to a cannabis clinic, and this doctor spoke to us about the benefits of medical cannabis, and he says, "I think you should try it." And she was kind of anti. I don't need it. I don't use it. And I think about a week later, she went back and she says, "You know what? Maybe I'll take you up on that just for inflammation." She started redoing all the studies.
That's usually what happens. The first time patients or individuals hear about cannabis as a therapy, they have this knee-jerk reaction where because of prohibition, they want nothing to do with it. And then after they think about it a little bit and maybe hear about it again, maybe 2 or 3 times from trusted sources, they realize, well, it's not the evil demon weed
drug,
and look at all this ibuprofen I'm taking. Maybe my stomach won't be as upset if I use cannabis to reduce inflammation in my joints. And then they come back a month or 2 later, thank you, I wish I had tried this.
Or they're seeing what it's doing to their loved one and seeing the benefits it's giving to their loved one. And they say, well, it's working for you. I might try something, helping with sleep, helping with anxiety, helping with stress. And so back to the 5 pillars that we spoke about earlier about brain health. I know we touched up on this on our last lesson, but this is our closing lesson. Can you talk about the benefits of the 5 pillars of health for patients and their loved ones and the importance?
Yes, they're all very important. It's about preventing illness and improving quality of life and longevity. Changing your lifestyle to include education will improve your cognitive reserve. We mentioned earlier that when bad things happen to good people, the amount of cognitive reserve you have as a result of a lifelong of intellectual pursuits, that will help you maintain function better than if you had not pursued those academic pursuits. We know that to be true. We know that individuals who are socially active remain healthier. All these things about nutrition that we've been discussing clearly are essential for people to monitor and maintain throughout their life. And if there is a deficiency, that needs to be supplemented. I mentioned earlier that for most patients or individuals, again, before they become patients, right? For most individuals, eating a well-rounded diet usually provides enough, but not for everybody. Sometimes you need a supplement.
And even the 5 pillars, if you're unable to do all 5, try to do 1, try to do 2. Not everyone is able to get out. Some patients aren't able to get out and they live alone. But if you're able to, eat healthy, hopefully you're getting some good rest, pick up a musical instrument. I can entertain myself with a musical instrument. I can entertain myself with a run by myself. I can entertain myself with a ride by myself. And, be active, get out if you're able to get out. Have conversations with friends and loved ones if you're able to, and try to incorporate these into your lifestyle on top of having a rounded discussion with your doctor as well. And is there anything else you want to add to this final module here?
Well, you just reminded me that, in the United States, there's a problem with childhood obesity. And a lot of that, I believe, has to do with the lack of exercise that a sedentary lifestyle supported by online entertainment produces. So, Michelle Obama was big into this. We know that if we can get kids to be more active and be more social and maybe have a little less screen time, they'll be healthier overall. So that's all part of the social and exercise and nutritional pillars that we're talking about.
Good. Well, thank you for this. It's been an incredible module. I hope you enjoyed this module. I look forward to seeing everyone on our live Q&A where you can ask Dr. Stein personal one-on-one questions. We'll answer them live on the air. If you're unable to attend, please submit your questions. We'll answer them on the air, and you'll have access to all of these questions as well as our modules and Q&As in your patient portal. Until next time, we'll see you in module number 3. And thank you again, Dr. Stein.
My pleasure.
Have a good evening, and thank you, and good night. Like many of you, I'm always grateful to learn about the range cannabis has in not only treating, but helping prevent ill health. Be sure to continue to explore the relationship between cannabis and the 5 pillars of health. As you're doing some of your own research, let us know what you're seeing and how Dr. Stein and I can help you clarify any concerns or questions as they come up. Throughout module number 2, we've looked at brain health and brain illness. As we leap into our next few modules, we'll discuss specific brain disorders and diseases, and how and why medical cannabis works to treat suffering from poor brain health. As always, thank you for listening in and being on this journey with us.